good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions each Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines that we've received through today, the 5th of October. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion again today is Sophie Buskowski, who's a student research assistant with the Institute. So Sophie, I now turn it over to you.
Thank you. Hi, Dr. Murphy.
Hi.
So for some updated statistics, so here in Illinois, 46% of the population under the age of 18 is fully vaccinated, and populations from 18 to 65 have 59% fully vaccinated. There's also been a decline in cases in Illinois with an average case of 2,675 cases per day and a 28% decline over the last 14 days. Florida, Texas, and the US have all had a massive decline, but unfortunately, we're seeing a huge spike in Alaska with a 54% increase in the last 14 days. And here in the United States, there has been a big population that has been fully vaccinated with over 56%. And like I said prior, there has been a massive decline of a 28% decline over the last 14 days. What can you tell us about some of these numbers that we're seeing over the last 14 days?
Well, the United States is behind most of the developed countries, most of the wealthy countries. The United States lags in the proportion of people that are vaccinated. To reach herd immunity, we used to think it was somewhere around 70%, but because the Delta virus is so contagious, it really needs to be up around 90%. So some of the Western European countries and a few other countries around the world are getting very close to that 90% mark. Iceland, Denmark, they're all, hovering around 80% right now, and they're seeing really a dramatic decline in the number of cases, but they're even going further. They're shooting for that 90%. So we still have a ways to go.
Well, hopefully we'll hit herd immunity soon.
Mm-hmm.
And for some headlines, there is this pill to treat COVID. Can you tell us a little bit about what this pill has and what it's doing and what it will look like in seeking authorization?
Yeah, it's the one pill that got the press recently was made by Ridgeback Pharmaceuticals and partnering with Merck Pharmaceuticals, the big company. It's called Molnupiravir. It's a polymerase inhibitor that works against the SARS-CoV-2, the virus that causes COVID. And they had a study with over 700 people in it, and they found that once you're these are high-risk people, once you're diagnosed and you start taking the pill, the hospitalization rate dropped by 50% and the death rate dropped 100% compared to people who took placebo. So it's a placebo-controlled randomized trial. So that's very encouraging news because it's just a pill. This opens up a whole new strategy of test and treat. You feel sick, you've got some kind of congestion in your head or whatever, you get rapid tested, you're positive, you take this pill, you're going to have a lot less complications. Your other option is to take the monoclonal antibody, which is great. It actually works better, but it's intravenous. You've got to go to a hospital or some setting where they can give you this intravenous infusion. It doesn't take that long. You have to stay around for about an hour afterwards. It works great. It's very expensive. And it's just cumbersome. So it's not going to be the answer to this problem. Whereas these pills that are coming forward by the three companies, may really be a game changer in addition to continuing to push the vaccines.
Well, that is wonderful news. And for some sad news in Alaska, there has been a huge surge and doctors are having to decide who lives and who dies in their ICUs. Can you tell us a little bit about this surge that we're seeing in Alaska?
Yeah, Alaska's in a lot of trouble right now. These hotspots pop up around the country and around the world. And, Alaska just, didn't take the strong enough mitigation measures, and they don't have a high vaccination rate, and they don't have a huge infrastructure up in Alaska. It's, relatively few people up there in a very big place. It's just overwhelmed the medical system. It's very unfortunate.
Yeah, it's very sad. And for some good news, in New York City, with a mandate for the school system, there is a huge increase in teachers and principals and staff who have taken the vaccine. What can you tell us about this mandate?
Well, these mandates are great because they're working. And many schools, hospital systems, companies, United Airlines here just mandated it. Other airlines are following suit. And most people are getting vaccinated. That's the really good news. The few people that won't take it are being terminated, and that's being held up in the courts. That the companies have the right to do that to protect the other employees.
Well, hopefully that will happen in more places. And for some questions
like it is, so that's what's happening.
Yeah, and for some questions from viewers, we have a question about Thanksgiving with approximately 12 immediate family members. Some of these older grandchildren are not going to get vaccinated and would like to know if they can take a COVID test prior to the Thanksgiving event. Do you think that this is sufficient to make them safe if some members are vaccinated and some are unvaccinated?
No, it's not safe. You've got a multi-generational gathering with grandparents, adult grandchildren, and parents. And you've got two young people who probably can tolerate having the disease, but they're at very high risk for exposing. There's no reason to take that risk. Even if they said, oh, we'll go get tested, well, you should be vaccinated. And maybe if you're coming from a high risk place like Georgia or Louisiana, Florida, or Texas, yeah, you should get tested also. But it's totally irresponsible for these younger people to not get vaccinated when they can, because they're going to put their families at risk. So they shouldn't let them come.
Yes, absolutely. And for our second question about increased back pain and sciatic nerve pain after taking the Johnson & Johnson, is this common, and has anyone else complained of this that you have seen after taking Johnson & Johnson?
Yeah, no, this is very uncommon, sciatica. This is pain shooting down the leg. And, there are some neuropathies that are associated with the vaccines, and Johnson & Johnson in particular, Guillain-Barré syndrome, Bell's palsy, very rare complications, but this does not sound like a vaccine complication.
Okay, and also for an individual experienced arm pain after receiving first and the second vaccine, and after getting the booster, they had pain, fever, chills, and body aches. Why is this, and shouldn't their body recognize the vaccine and have a similar reaction to the first and second?
Yeah, no, this is actually the expected response, because what's happened is the first two shots really revved up the immune system. So when it saw that booster shot, it was really ready to go and respond to that. So it's the robust immunologic response. So this is totally expected.
Awesome.
But
And for this,
it's usually not any worse than what this person is describing.
And this individual was vaccinated on February 25th. They got COVID on August 16th, and they were wondering if they should get the booster now or should they wait?
They should get the booster, but they can wait 3 months after having the breakthrough COVID that they had in August. So that would be September, October, November. So mid-November, they can take the booster.
And should they get the booster at all?
Oh yeah, they should definitely get the booster.
Okay.
There'll be what's called a hybrid response. And a hybrid response is where you actually have the natural antibody from the virus, and then you have the antibody from the vaccine. So you get both, and it's considered really good.
This individual, similar to the question above, their sibling had recovered from COVID and now is claiming that she has natural immunity. A friend who also got fully vaccinated developed severe joint and heart issues from getting COVID. Should everyone who recovered from COVID get fully vaccinated, or just the booster?
Yeah, they should, everyone, whether you had COVID or not, should be fully vaccinated. And if it's with the Pfizer vaccines and you're at high risk, over 65 now, or you have any kind of underlying medical condition, you should take the booster. That's going to give you the optimum protection against getting COVID. because the one thing in these breakthrough infections, which we don't really know yet, but we suspect, is that, you could have long COVID. You could be a long hauler type person with all sorts of mental fogginess and other strange side effects. And so we want to avoid that as well. So you don't want to ever get COVID if you can help it. And
Right.
the best way is to stay vaccinated and take boosters as recommended.
Absolutely. And lastly, this individual had gotten their 2 Pfizer shots last March and is fully vaccinated. They're 67 years old and they're eligible for the booster. Their concern with the 3rd shot is that if another variant shows up and isn't covered by the current vaccine, will they need to get a 4th shot? Since the 3rd is not altered in any way from the first 2, can they just get a half dose or do they need the full dose? They're a healthy 67-year-old. What do you recommend for them?
There's a bunch of issues here. Well, let's start with the need for a booster in somebody who's 67. The efficacy of the Pfizer vaccine starts to wear off after 4 months. You're still protected from severe disease and you can still die from it, particularly if you're at high risk, which includes being over 65. So this person needs a booster, no questions about it. It's the same shot they got the first 2 times. Now, Moderna, they have looked at a booster shot that is a half a dose of the original one. Now, Moderna is dosed higher to start with. They're 100 micrograms. Pfizer is 30 micrograms. And the booster that Moderna is using in studies is 50 micrograms, so half the dose. So anyway, what will that do? Well, they've shown, Moderna has shown that the immunologic response you have to that half dose is just as good as if you took the full dose. So what does that mean? It means you can give twice as many doses. And so that's going to save a lot of money and increase the supply of the available vaccine, which is important worldwide.
Right. Well, those are all of our questions from our viewers today, and that is all that we have for today.
Have a great day.
Thanks, Dr. Murphy.